Priyanka, we are live. It's good to go.
Good afternoon, everyone. A warm welcome to all the respected doctors joining us today. I am Ankita Sharma from the product marketing team, and on behalf of entire Dermaglow division of Hetero Healthcare, would like to thank you all for taking out your valuable time to be a part of today's session on topic low dose oral minoxidil. It is my privilege to introduce our esteemed speaker, Dr. Priyanka Patil Nikumbha, a distinguished dermatologist practicing at Ortho Derma Clinic, Thane, and a visiting consultant at Thane Healthcare Hospital. Dr. Priyanka has enhanced her expertise through prestigious fellowship in dermatosurgery, laser, and aesthetic dermatology from renowned organizations such as ACSI, IADVL, and also National Skin Center Singapore. Dr. Priyanka has authored multiple publications in both national and international peer-reviewed journals, reflecting her strong commitment towards academic excellence and evidence-based dermatology. Her key areas of interest include trichology and aesthetic dermatology, where she combines scientific knowledge with extensive clinical experience to provide an extensive advanced patient care. We are delighted to have Dr. Priyanka Patil with us. We look forward for an insightful and a very enriching session. So thank you so much, ma'am, for taking out your valuable time to be a part of, to collaborate with Dermagro Division. So ma'am, now the platform is yours. You may continue.
Sure. Thank you so much, Hetero Healthcare, for inviting me for a talk on a very dear topic for me. Uh, Good afternoon, everyone. Today we'll be discussing about low-dose oral minoxidil and trichology, where we can use it, when to prescribe it, and how to prescribe it safely. Now, oral minoxidil has definitely been a game changer in the treatment of hair loss in terms of increasing the adherence. It is definitely a breakthrough product which has changed the treatment of trichology because it's a convenient treatment option. Because many patients find a daily pill is much easier than applying the messy liquids twice a day. So, why this matters now is because low dose oral minoxidil has moved from rescue therapy to a mainstream option. In some patients, it is in fact a first line treatment for hair loss. And now we have a standardized protocol and a standardized treatment guidelines which are available in the form of 2025 International Delphi Consensus, which gives us the indications, contraindications, and evaluation, monitoring, and adjunct therapy guidelines. The strongest agreement in this consensus was reached regarding the use in adults with AGA or age-related thinning, where topical minoxidil can be ineffective or challenging. Let's look at the mechanism of action. Oral minoxidil or minoxidil per se stimulates the ATP sensitive potassium channels. So it causes the dilatation of the blood vessel, increasing the delivery of oxygen and nutrients to hair follicles. The WNT beta catenin signaling pathway is induced with minoxidil and with release of vascular endothelial growth factor. It works also as an anti-inflammatory agent, reducing the perifollicular microinflammation by inhibiting various inflammatory mediators. Also has a mild anti-androgen action, reducing the expression of 5-alpha reductase type 2 gene. So overall, it enhances the synthesis of DNA in the anagen bulb, tries to keep a lot of hair in the anagen phase, reducing the telogen phase. Looking at the pharmacokinetics, it has a rapid, almost complete absorption. The peak serum levels are seen in about 1 hour. The distribution is widely distributed because of the low protein binding. It is primarily metabolized in the liver by glucuronidation, hydroxylation, and sulfation. So the active metabolite is a minoxidil or sulfate. The active metabolite now can accumulate in a patients with renal impairment. So it should be used in caution in case of patients with renal dysfunction. It's often used for hair loss at low dosage. This is important that it is an off-label treatment option, but it is FDA approved for hypertension at much higher doses, like 10 to 40 milligram or 100 milligram in the refractory hypertension. Patients can take oral minoxidil in fed or fasted state because food does not impact the bioavailability. Looking at the indications, it is mainly used for pattern hair loss, effective for both male and female pattern hair loss. It's been seen the improvement in the hair growth is more pronounced in the vertex region as compared to the frontal region. Other hair disorders like chronic telogen effluvium, scarring alopecias like lichen planopilaris, alopecia areata, loose and Nugent syndrome, chemotherapy-induced alopecia, all these disorders can be treated with oral minoxidil. Looking at the dosage, in males, the dose is initiated at 1.25 milligram per day and can be increased by 1.25 milligram per day if required every 3 months, up to a maximum of 5 milligram per day. In females, the dosage is initiated at 0.625 milligram per day. And if needed, it can be increased every 3 months to a maximum of 2.5 milligram per day. After the initiation, we can see the visible hair growth after 3 months. And if there is no satisfactory response, we can consider updosing. So in clinical practice, we usually follow start low and go slow, which is the safest prescribing philosophy. Looking at the clinical evidence, there are multiple publications which are now available about low dose oral minoxidil safety and efficacy. There's a particular publication which has shown comparison between low dose oral minoxidil of 1 milligram dosage with topical minoxidil. Now, the hair diameter, density, and overall superiority of the treatment was comparable. However, the adherence is much better with oral minoxidil, and of course, local irritation is almost none. So, it is best viewed as a convenient alternative rather than a universally superior one. Let's look at the side effects. Now, these are dose and duration dependent side effect, as we can see in this figure. The most common side effect is obviously the hypertrichosis with excess hair growth on the face or a body. On the face, it is usually seen more on the temples and the side locks. Then is the dread shed or the temporary shedding, which is a transient increase in hair loss that occurs in the first 2 to 6 weeks as the old hairs are pushed out for new growth. Cardiovascular symptoms. These are rare at the low doses that we use for hair loss, but can include lightheadedness, fluid retention, headache, or a tachycardia. Contraindications should be avoided by pregnant or breastfeeding women. It's a category C drug, and those with a history of certain heart or kidney conditions. So, looking at how to manage these side effects, because I believe a well informed patient is much more likely to stay on therapy and report the problems early rather than stopping abruptly. So, hypertrichosis is a manageable trade off in many patients, not an automatic reason to abandon the drug. We can either lower the dose or patients are happy enough to use any temporary hair reduction methods like shaving, waxing, the depilatory creams. There are few studies which have shown even use of eflornithine cream helping along with certain oral anti-androgens which are used in the pattern hair loss such as bicalutamide or spironolactone helping with the minoxidil induced hypertrichosis. Coming to temporary shedding, it is a common side effect, usually resolves by 8 weeks. So, counseling the patient is generally enough. Okay, and the cardiovascular symptoms, the postural hypotension or lightheadedness can be avoided if we prefer a night dosing. That's why we give a night dose to the patients. In case of fluid retention, ankle swelling, racing heart, these have to be reported immediately because in patients who have edema prone states, the caution is essential even with a low dose vasodilatory effect becoming clinically relevant. So, what should you counsel before prescribing? First thing you should always mention it's an off label use and the expected time to response is measured in months. Hypertrichosis is the commonest side effect. The other cardiovascular side effects are uncommon but should be reported. Inform the patients that the goal is gradual improvement and not an overnight regrowth. Also, ask patients during summer months specifically to take electrolyte containing beverages, especially magnesium and potassium. Now, looking at the monitoring, it is usually not recommended, but I do start at baseline with pulse and BP monitoring. Monitoring regularly in case of patients taking antihypertensive medications at the start of treatment, and also if the patient complain of any symptoms. But clinical judgment matters in this case, especially when a comorbidity exists. You should always consult a cardiologist before prescribing the oral minoxidil to a patient with a history of heart disorders, particularly in the elderly. Now, there are certain publications which mention an idiosyncratic reaction in the form of pericardial effusion. So, the cardiology patient should always be started on minoxidil only after consulting a cardiologist. How to combine it? we need to now pair the low-dose oral minoxidil with diagnosis-specific therapy. Why? Because low-dose oral minoxidil is going to be a growth enhancer. It is not a substitute for correcting the underlying diagnosis. So, finasteride, dutasteride in men, anti-androgens in women in case of pattern hair loss, iron correction, anti-inflammatory treatment, or procedural adjuncts. Now, for example, in case of alopecia areata, they have found tofacitinib plus oral minoxidil is much more efficacious than tofacitinib monotherapy. Now, a few myths which have to be cleared is it's too risky because it is an antihypertensive, which is not true. The alopecia doses are much lower, so it is much safer in appropriate patient. More dose means better results. Not really true. Adverse effects rise with dose, so you have to be cautious while updosing. It only works for severe alopecia falls because many patients use it earlier as a convenience strategy. So, my take home would be low dose oral minoxidil is an evidence supported off label option for selected hair loss patients. The best practice is patient selection. So, low starting dose, careful counseling, and dose wise titration. So, right patient, right dose, right counseling. That should be the motto while prescribing your oral minoxidil. And now we have the standardized guidelines in form of the Delphi consensus. So, in short, my talk can be summarized in a single slide. So this would be it. Now, looking at the minoxidil tablets, these are available in two strengths, 2.5 and 1.25 milligram, and these are scored tablets. Thank you. Yeah, yeah, yeah. I'm done with the talk.
Thank you so much, ma'am. Thank you so much, doctor, for such an insightful and informative presentation. We truly
Thank you.
appreciate for taking out your valuable time and sharing your valuable knowledge and clinical experience, and also giving in such an important takeaway message to all the
Thank you.
audience who are attending. I am
Thank you.
sure that the audience must have gained so practical insights from your session. Thank you so
Thank
much,
you.
doctor.
Thank you so much.
So, ma'am, with your permission, we will move ahead with the few commonly asked
Sure,
questions.
sure. Sure, sure.
So, ma'am, actually, in your presentation, most of the questions are already been answered, but still, I
Okay.
would like to once
Sure.
again ask those questions. So, the first most common question is, in which type of patients do you prefer oral minoxidil?
Usually, the patients who are on topical minoxidil who are not responding that well to topical minoxidil, if they have any rash or any irritation. Secondly, if usually I prefer in case of a little severe grades of alopecia, grade 3, grade 4, or those people who have more vertex involvement. In those, I usually would be preferring oral minoxidil. And of course, after ruling out the contraindications.
All right, ma'am. Thank you so much. The
Yeah.
next question is, ma'am, what are your views on initiating a treatment? It should be with oral minoxidil, with topical minoxidil, or it can be with the combination of both oral and topical.
I know usually the senior practitioners do advise not to start the oral and topical together, but in my experience, I do usually start them together for a little faster response. And in fact, there have been studies which have shown that if the patient is already on topical minoxidil and you add oral minoxidil, you can avoid the temporary shedding or the dread shed. So I usually prefer using a combination, keeping asking the patients to report back to me if they feel any of the side effects.
All right, doctor. Thank you so
Yeah,
much.
yeah,
The next question is, yeah, this is already answered. That is there
yeah,
any initial shedding with the
yeah.
oral minoxidil?
Yes. So it usually starts after 2 to 6 weeks, and which is really common with a topical minoxidil as well. But it usually gets controlled after about 6 to 8 weeks. So that is something we can manage with the counseling also. That is where we understand the medicine is working.
All right, ma'am. So, ma'am, in continuation of this question, we have received a question in the chat box. So, the question is, how do you counsel the patients? Because usually the patient often get afraid that even after taking the medication, there is still an hair fall. So, how
Hmm.
do you counsel those patients?
For the dread shed.
Yes.
Okay. So usually we tell the patients how the hair cycle really works about. So what minoxidil is going to do is not going to cause any extra shedding. It will be the hair that was going to be shed in the past 3 months, which is shedding together. So minoxidil is just resetting your hair cycle, and this is not an extra shedding. And all good things come with time. So you just have to be little patient and after that, you will see the fruit after 3 to 6 months. So whatever efforts that you're putting in, you will start seeing the results after 6 months. So just be little patient because consistency and patience always pays. That way.
All right, ma'am. Thank you so much. The
Sure.
next question is how soon the benefits appear as compared to the topical minoxidil?
I personally have seen the benefits appearing as early as 3 months, but we definitely wait out for about 6 to 9 months to see any optimum response.
All right, ma'am. Thank you so much. Moving to next question. So the next question is there any difference in the quality or the texture of the hair growth seen when oral minoxidil is given and when it is compared with the topical minoxidil?
In terms of hair diameter and the caliber and density, there is not much of a difference, but the texture definitely is because topical minoxidil, however, there have been the dipropylene glycol based preparation, aqueous based preparation, but there is going to be a bit of texture changes which are seen. That is definitely we can avoid with the oral minoxidil.
All right, doctor. The next question is any precautionary measures that need to be taken before starting the low dose oral minoxidil?
So usually I take a proper medical history. We need to rule out any cardiac or a renal dysfunction. Other thing is anybody who is more prone to orthostatic hypotension or somebody who is already having a low BP. In these patients, I would usually avoid oral minoxidil, maybe start it with a caution, with a regular monitoring, because there have been studies which have shown the BP changes can be seen after 6 months of use, but that is like 4 millimeter for systolic BP and 2.5 for diastolic BP, which may not be that much significant in a normotensive patients without any hypertension. But somebody who has a low BP, this can be significant. So these are some of the things that I would take care of. And of course, the pregnancy and lactating patients because it's a category C medicine.
All right, doctor. Thank you so much.
Sure.
The next question is what is the ideal duration for prescribing the low dose oral minoxidil? And how do you decide when the therapy needs to continue or when it can be stopped?
So the optimum treatment response would be seen after 6 to 12 months. But just like topical minoxidil, I do counsel people that it is going to be a lifelong treatment. However, we do come to a little adjustment regarding the combining the topical minoxidil with oral minoxidil as per patient's schedule also. So sometimes maybe alternate day they be taking oral minoxidil or a weekend therapy for oral minoxidil and topical minoxidil on the rest of the days so that the patient's schedule is also taken into consideration. But eventually they will have to understand or accept the fact that this is a lifelong treatment. Or for male patients, I usually tell until your wife wants hair on your head, you will have to continue this.
All right, doctor. Thank you so much.
That's
So, ma'am, these were the few commonly asked questions regarding the
sure,
low dose oral minoxidil. So, we have
sure,
also received few questions in the chat box. So, I will just read
sure,
out those questions.
sure.
So, firstly, a question that we have received is was into a continuation of your previous question. So,
Hmm.
the question is, what if a patient suddenly stopped taking the oral minoxidil without even consulting the dermatologist?
Then other thing is whatever goodness we have achieved, usually it is going to reverse. It will take about 3 to 4 months, but the effect that we have received, that we are trying to keep the hairs in the anagen phase, that is definitely going to reverse. So the results would be reversing after the 3 to 4 months if they stop taking it abruptly.
All right, doctor. The next question which we have received, it's a case-based question. So the
Hmm.
question is, if a female patient with PCOS associated hair loss is started on low-dose oral minoxidil, so are there any additional consideration that you would suggest to keep in mind before prescribing?
First thing is I would like to check whether she also has a hirsutism associated PCOS. and whether she's taking any laser hair reduction treatments also in regarding to that. What are her hormonal levels regarding? Because the counseling regarding the facial hair growth has to be considered. Secondly, if what treatment she's on for PCOS. If she's on a certain treatment, we might add something like a spironolactone or a bicalutamide, an anti-androgen that will help us to counteract the minoxidil-induced hypertrichosis also. So it's not completely ruled out in a PCOS cases, but you have to choose the patients who are and counsel them regarding the hirsutism part.
All right, doctor. Thank you so much
Sure.
for such a detailed
Thank you.
answer.
Thank
Moving to the next question which I have received is if a patient reports increased hair shedding within the first few weeks of starting the oral minoxidil, then how would you explain this phenomena and reassure the patients? So it's similar to the
you.
counseling
Yeah,
that
yeah,
you answered.
yeah,
Mhm.
yeah. We can move on to the next.
Next question is
Yeah.
have you observed any difference in the response rate among various types of alopecia treated with oral minoxidil?
So, more predictable response is seen with a pattern hair loss. But in case of chronic telogen effluent, also we see a good response within 3 months. In case of loose anagen syndrome, it has been seen that after 12 months, the results do not reverse, which is a very encouraging response. In case of alopecia areata, it depends on how much is the control that is we have achieved about the hair loss with the other immunomodulator treatments that are associated with it. So that in case of alopecia areata, it can differ, and you'll always have to combine it with something so that we are not completely losing out the hair when we stop the minoxidil, or we are going to reduce the dosages.
All right, doctor. Thank you so much. The
Yeah.
next question is, which are the trichoscopic parameters that you would suggest to monitor to evaluate the efficacy?
First would be the hair shaft diameter variability, more than 20%. That is usually for what we see in case of pattern hair loss. The diameter variability definitely improves. The hair diameter becomes more uniform. The density of the hair becomes more better with this. So these would be the parameters usually we would be seeing in case of trichoscopy monitoring for a pattern hair loss.
All right, doctor. So, ma'am, we have also received it's a case-based questions again. So the
Sure.
question is, a 29-year-old woman with female pattern hair loss has been taking oral minoxidil for 4 months, and now she has informed that she is planning for pregnancy. Then how would you manage her treatment? Would you ask to continue or you could discontinue regarding the oral minoxidil?
See, it's a category C medicine. So, and in case of pregnancy, what my approach is first do no harm. So, in the first initial sessions, definitely I would stop oral minoxidil, maybe shift her to a topical peptide or a topical minoxidil, but definitely under the counseling.
All right, ma'am. Thank you
And
so much.
during pregnancy, anyways, the I would counsel her during pregnancy because of the hormonal changes. Anyways, she's going to have a very good hair. Problem will come only after a postpartum hair loss. That is something we can manage when she visits after her delivery.
Okay, okay, ma'am. The next question is, ma'am, what are your views on combining the oral minoxidil with other molecules such as dutasteride and finasteride, and
Yeah.
also with other therapies such as PRP or hair transplantation?
It is definitely helps. The procedural adjuncts are going to help. It's because low-dose oral minoxidil, again, as we stress, it's a growth enhancer. So the oral anti-androgens, the dutasteride, finasteride, they are going to be as per the indication that you are treating. So those are indication-specific treatments. So the procedural adjuncts would be definitely supportive of oral minoxidil will be a growth enhancer. The disease specific treatment has to be considered and along with your oral minoxidil. So it is going to help.
All right, ma'am. Thank you so
Sure.
much. So these were the few questions that we have received in the chat box. So, ma'am, before we conclude the session, would you like to share any of your interesting case study or any clinical experience related to oral minoxidil with the audience?
Yes, I've had a patient of a female pattern hair loss. She initially presented to me actually related to an allergic contact dermatitis to the hair patch she was wearing. And when the low dose oral minoxidil was newly introduced at the time, and she had lost all hope until this time that with the topical minoxidil or anything that she could get any hair back. So she was actually just using hair fibers and a hair patch. I started her on oral minoxidil along with dutasteride because she's postmenopausal. So for so many years, she was suffering, literally had lost her confidence and was not really going out for social function. And oral minoxidil really changed her overall look and the hair growth that she received and the smile that I saw at the end of the treatment. And still, she's still on oral minoxidil and she's very happy with the kind of results she has achieved. For her, this has been a very life-changing treatment. Of course, she has received other anti-androgens also. She's undergoing procedures also. But at the end of the day, she could not believe she could have a hair growth, but which was made very much possible with oral minoxidil. So she and I both are very happy with her treatment results.
Thank you so much, ma'am, for sharing your
Sure,
clinical experience. It
sure,
definitely gave a better understanding for this aspect regarding this treatment.
sure,
So, ma'am, we are at the end of the session. So, would you like to
sure.
give one practical key takeaway message to all the fellow colleagues who are attending this session today so that they can use that
Yeah.
key takeaway message in their daily practicing before prescribing the oral minoxidil?
Sure. So oral minoxidil is a very safe and a very effective treatment option in selected cases. Definitely when you rule out any medical contraindications, and it is a very safe treatment option to be used. And with a proper monitoring in the right patients with the right counsel, it can give you really wonderful results. And now we have standardized guidelines regarding the prescribing the molecule, so it's not really exactly very new molecule as such or anything uncommon treatment that is. It is a very good treatment option to consider. And other thing is the topical minoxidil lotions are little on the expensive side. So an oral minoxidil becomes a little cost-effective treatment option for a lot of patients. So you can give it to more patients who cannot really afford or stop the treatment because we live in a country where the treatment cost also depends a lot about the adherence part. So adherence is much more better with the oral treatment also. So that aspect is also covered in case of oral minoxidil. Yeah,
All right, ma'am. Thank you so much for giving such
sure,
an important key takeaway message that I'm sure
sure,
that all the doctors must have definitely noted down.
sure.
Thank you so much, ma'am.
Thank you so
So
much
we are
for
at the end of the session. So once again,
sure.
I would like to say you thank you for such an insightful and a very engaging session. Your
Thank
valuable
you so much.
expertise and presentation has greatly enhanced our understanding. And also a
Sure.
special thanks to you for answering all these questions very patiently
Thank you.
and also
Thank you.
giving such a detailed answer for every question. So
Sure.
I'm really sure that all the audience must have definitely gained so much insight from this session.
Sure. Thank you so much for Hetero Healthcare for giving me an opportunity to talk on this topic. Thank you so much.
Thank you, ma'am. And
Sure.
also, I would like to thanks to all the doctors and the participants who have joined this session. Your active participation and contribution has made this session a really successful one. Thank you once again, everyone. I hope to see you all soon once again in our future scientific sessions. Thank you, everyone.
Sure.
Thank you, ma'am.
Thank you.